The murmur of atrial septal defect is a systolic flow murmur across the pulmonic valve coupled with a fixed split second heart sound. Listen to a patient with an atrial septal defect. I will begin with 3 normal beats, and then add the split second heart sound, and then the systolic murmur. The murmur and the fixed splitting of the second heart sound are usually heard best at the second left intercostal space with the patient sitting up. The opening between the atria that allows left to right shunting is acoustically silent. However, the increased flow across the pulmonic valve produces a grade 2 to 3 systolic murmur. Atrial septal defect may not be diagnosed until adulthood. Some patients may present with dyspnea on exertion or palpitations. The fixed splitting of the second heart sound is caused by a delay in pulmonic valve closure due to prolongation of right ventricular ejection. This results in a pulmonic closing sound which is consistently later than the aortic closing sound. The decision to close an atrial septal defect is based on the presence of right heart overload. Percutaneous closure of the defect is possible in some patients with secundum atrial septal defects. Following successful closure, patients have better exercise tolerance and decreased right ventricular size. Generally, patients who have their atrial septal defect closed by age 25 have an excellent prognosis. In summary, atrial septal defect is a common congenital lesion. The flow murmur across the pulmonic valve and a fixed, split second heart sound are key findings in this diagnosis. Listen once again to an atrial septal defect.